labubu very quickly became a la-poo-poo. Nothing to see here. This is a doozy. How do you feel about circumcision?
What?
IBT Midwife. That is the story of us. We even did our engagement photos in the emergency department, like on a stretcher. Man, you guys have some great questions. Here are frequently asked questions by you. When you have a public platform, people ask questions. People ask lots of really, really interesting questions. Today we are going over a whole bunch of them. Questions that have been asked by you, either to me privately, or they have been commented on videos, whatever it may be. It's going to be like about me, about nursing, childbirth, postpartum, breastfeeding. You know I love to talk about boobs. It's going to be all sorts of things. My name is Tina. I'm a certified perinatal nurse. I'm a certified breastfeeding specialist, and I'm also a mom of 4. I've been around the block a few times here. If you're new here, welcome to it. Please consider subscribing and coming on back and learning even more things. If you are not new here, let me know in the comments, how long have you been here? Are you like an OG hanger-outer, or have you just joined the chaos? Let me know in the comments. I'm going to start with an easy question, and that is, how long have I been a nurse? And the answer to that is actually 17 years. I graduated in very late 2006, very early 2007. So I have been doing this for a very, very long time. Mind you, I do have 4 kids, so I did take 4 mat leaves in that 17-year period, but I started in emergency nursing. That was like where my passion was. I worked there for quite a lengthy period of time. I also did some travel nursing in emergency departments. So I actually worked in Los Angeles and I worked in Sydney, Australia. That was really, really cool. It's definitely, if you're in nursing, travel nursing is really, really cool. Do that before you have like kids and a husband and a dog and all of the things. So travel nursing, very, very cool. I actually did a small stint in ICU. Very quickly, I figured out that ICU, not for me. I thought it was for me, not for me. So I went back to emergency, and then eventually I made my way up to labor and delivery. That is sort of where like I always wanted to end up in labor and delivery. I finally had an opportunity to take a casual position, which here in Canada basically means that you schedule yourself and you pick up, however many shifts you need to when they are available. But I took a casual position. I was able to do the labor and delivery course, which was really, really cool. Very, very brain stimulating. And then I've been in labor and delivery ever since. And then I've been doing the social media bit for probably 2.5, 3 years now, and it has been ultimately the most rewarding thing because I'm able to reach more and more people and bring really good sort of bite-sized digestible information to people who really need it and ensure that there's accessible and equitable care for everybody who wants to hear me yap at them. And I thank you for being here and listening to me yap, and maybe I'll make the next question a bit more exciting. When you work in healthcare, quite often you become a party trick, and so as soon as somebody finds out that you're a nurse or a doctor or whatever it may be, they're like, what's the wildest thing that you've seen at work? And I often ask people, like, do you actually want to know the wildest thing that I've ever seen? Because a lot of times the thing that you're thinking of is not the thing that I'm thinking of. The wildest thing for me are like the things that have actually put me into therapy. I know what you want to ask, and you want to know what's the weirdest thing someone's put up their butt. And I can tell you I've seen a lot of things be put up people's butt. Probably the weirdest one was actually a light bulb. That guy and that bulb were not very bright. Yeah, recently they pulled a labubu out of there, which to me is a sin because I've tried to get a labubu and it's really quite a process that involves a lot of time. So for somebody to just waste that and putting it up their butt, that's a real sin. But that labubu very quickly became a la-poo-poo. Next up, how do you feel about vitamin K for babies at birth? I am very much pro vitamin K. That said, I understand that there's a lot of people who have heard things on social media or who have deep-seated beliefs within themselves, and they feel like it's not best for their family or for their baby. I totally hear you. For me, I'm always going to side on the side of evidence and science and technology. I think vitamin K for babies has been an incredible advancement that has saved a lot of babies, and we can see that from the data. I'm not making it up that vitamin K has saved a lot of babies. But I also really want to show you this video up here. This video that I made sort of debunks a lot of the things that you may read and hear about on social media. The things like the black box warning, the aluminum in them, that it causes childhood leukemia. There's a lot of things floating around out there that is sort of swaying some parents to maybe not get the vitamin K shot. And if that is their informed choice, hey, that's your informed choice. But I definitely am on the side of vitamin K. I realize that not everybody may be, but that is my stance as a healthcare professional and as a mom. I did the vitamin K for all 4 of my kids, and I would do it again if I had another baby tomorrow. This is a doozy. How do you feel about circumcision? I feel like I wouldn't touch that question with a 10-foot pole. Circumcision, from what I have seen on social media, is one of the most polarizing topics that you could ever talk about, and I just never would, because never would. I actually had a friend who simply went over care after a circumcision, and she got absolutely roasted in the comments, spammed by anti-circumcision people. But she didn't tell people to get their babies circumcised. She simply said, if you choose to circumcise your babies, here's how you can care for it. So circumcision question, we are going to skip. Pass. Pass. This one has to do with my presence on social media and keyboard warriors. What's the meanest thing that anybody who doesn't know you has said to you? One person commented, you have a hateable face.
I'm sorry, I just hallucinated. What?
First, I don't really know how you answered that. Like, what do I say? Okay. I thought about like just doing like a thumbs up emoji because people love that one, but you have a hateable face. For like, in what scenario in real world life would somebody walk up to a stranger on the street and be like, hey, and you're like, yeah? And they're like, you have a hateable face. And then they would just keep on rolling with it. Like, so I didn't respond. I don't know how you would respond. The other one that I get a lot is that I have something in my teeth right here. There's not something in my teeth. That's not my breakfast. That's actually a hole in my teeth. My teeth are sort of shifting as I get older. The girl that hates the dentist has to go in for sort of some major mouth work. So those are the two things that I get quite often. The hateable face was probably the meanest. This question is one of my favorites. It is, what is your advice for somebody who is starting to breastfeed if they want to have a successful breastfeeding journey? Here's what I say. There's kind of two pieces of advice. First off, get your baby on your breast as soon as you possibly can after birth. Hopefully this is within the first hour. This can be a baby at the breast directly feeding, or if you are not planning on feeding baby at the breast, this could also be your breast pump. But you want to get that stimulation at the breast as soon as you can after birth. Now, if for whatever reason you are separated from your baby and you can't breastfeed them directly, you're going to want to hand express. Stimulate that breast with some hand expression. You can do it right into the hospital blanket, on your hospital gown. We don't care. I'm not taking the laundry home to do it myself. So you can get as many blankets dirty as you want. There's not like a hard limit of number of blankets you can get dirty. But hand express. Do something where you're putting that stimulation at the breast. That's going to help trigger our body to create that transition from colostrum to more mature milk. Now, the mistake I see some new parents making is they think that their milk is not in. P.S. It is in. It's colostrum. They think that their milk's not in, and so they feed baby by bottle, supplementing while they are waiting for their breast milk to come in, and then they're going to put baby on the breast. And this is sort of causing you a disservice in two different ways. First off, you're not putting that stimulation at the breast with the baby. The baby is now putting that stimulation into a bottle, and your breast is being unstimulated. So first off, we're telling our body, hey, nothing's happening down here. Pay no attention. Nothing to see here. The next reason is that when you don't have baby on the breast, you are now not removing the milk or the colostrum that is already in the breast. And to make more milk, we need to remove more milk more often. It is that frequent emptying of the breasts that's going to cause our brain to be like, the baby ate everything that we had in there, and then that extra stimulation says, but baby is still feeding, we need to make more milk. So it's kind of really doing you that double disservice if you are not putting baby on the breast. So I always say, even to have them on your chest, touching, licking, smelling your breast, all of those things can go a long way for a successful breastfeeding journey. The second thing I can say to people, if it's feasible and accessible to you, see an IBCLC. See them before you give birth, and then see them after that your baby is born, because they're going to give you tailored health and breastfeeding advice specific to you and your baby. They're going to take into account your pregnancy, your delivery, how was it, how was your blood loss. They're going to look at your baby, look at their mouth, see how they're feeding, see how they're positioned. They're going to give you that specific tailored healthcare tips. And that's going to be sort of what you need to see that furthered success. I think that we're absolutely failing women who are choosing to breastfeed because we're like, breast is best. Breastfeeding is amazing for you, but we're not going to support you with IBCLC services that are covered. We're not going to support you with a lengthy maternity leave so you can really bond with your baby and establish breastfeeding long term. We're just going to tell you it's amazing, but we're not going to support you to do it. And so I really think that an IBCLC should be a standard of care after you have a baby, but sadly it's not. If you are able to see one or a lactation specialist of any kind, please consider doing so. Oh, how long have you been married? And did you meet your husband at work? I know a lot of people in healthcare meet at work. So first off, I've been married 13 years in June. We got married June 2nd, 2012. It was the absolute wedding of my dreams. It was incredible. We've been married 13 years. Obviously, a lot of those years have been spent either being pregnant, being in the newborn trenches, and now raising our kids. So it's been interesting, I'll tell you that much. We met at work, but not in labor and delivery. So like I said, I used to work in emergency. We started dating, we got engaged I don't even know, really shortly after we got married, like a year and a half after that, and we have been together ever since. So that is the story of us. We even did our engagement photos in the emergency department, like on a stretcher outside with the emergency sign on the back. So I'll see if I can find that picture and put it up for you. It was pretty cute. It was pretty special. Did you have an epidural when you gave birth, and would you recommend an epidural? Now, I'll say this, 4 babies, 4 epidurals, 12 stars, definitely recommend. However, if I had another baby, I would do things a lot differently. Like when I had my first baby, he's 12 now, I didn't even work in labor and delivery. And then when I had my other babies, I was very new to labor and delivery. I wasn't really involved in a lot of the research that I'm involved in and a lot of looking into things and experimenting with other options. And so I would do things differently. I would still get an epidural. I would just wait longer to get the epidural. And I would really find some coping mechanisms that I really liked and lean into those to get me through till I was more dilated, like 6-7 centimeters dilated, somewhere in there, because I really feel like we can harness the ability to be vertical. We can harness the ability of our body to move in any angle in any direction that we like when you don't have an epidural. Because once you have an epidural, we can still reposition, and you should still reposition, which I did, but you just can't reposition the same way that you can when you can be completely vertical and your feet can be on the floor. Are you team OBGYN or team midwife? Sign somebody trying to figure out if they are team OBGYN or team midwife. Okay, I'm gonna tell you this. All of my babies were born with an OBGYN. These are, of course, colleagues of mine that I have worked with. I will say this, where I work, there is not a lot of midwifery care. I work in a hospital. They do have privileges there, but we don't see a lot of midwife patients. A lot of the midwives in my city will do birthing center births, and they will do home births. So I would say this, if I had another baby, I would probably find a midwife that I align with, but I would have my baby in the hospital. That's probably what I would do. I feel like midwives are underutilized here where I work. I know in other provinces in Canada, they definitely are more prevalent. Ontario, British Columbia for sure. I would love to see more midwife births. I think that they are stunning. I think that they are really, really peaceful and beautiful. I mean, I see all sorts of births. So I think if I had another baby, definitely a midwife, but it would have to be a midwife that I align with. So I really encourage people to talk to different midwives before they land on the one that's actually going to be at their birth, because if you have a midwife who isn't aligned with what you are wanting out of your birth experience, then it can really, really go sideways in a hurry, and then you might have felt like you wasted that opportunity. So definitely find one that you align with, but I for sure, it's been a long time since I had a birth, and with all of the information that I have now and where I think I would want another birth to go if I had another birth, I'd be team midwife. That's enough yapping for one day. But if you want another one of these for another day, just drop me a comment either by email. You can even comment on this video right here. Remember, nothing is off limits unless it's off limits, in which case I just simply won't answer it. If you like this one, give it a thumbs up. Check out this video for even more fun stuff that we do here on the channel. Consider subscribing. And as always, be happy, stay healthy, have fun. Bye.